Hello, my name is Edenrose Dastur Mackenzie, and I work as an Advanced Occupational Therapist, Team Lead for Surgery and Oncology at Cambridge University Hospital. Occupational therapy plays a crucial role in managing cancer patients to address their physical difficulties, cognitive difficulties, and emotional difficulties during their cancer treatment and after treatment. What got me into the role? Since I arrived to the UK, I see cancer patients on the wards I cover until I developed the specialist knowledge and skills. And the job had been very fulfilling because in the field of oncology, it is one of those specialties where I use my knowledge and skills because the care has been very holistic and very client-centered care. My main responsibilities as an occupational therapist include seeing patients on the ward. Because I am a ward-based occupational therapist, I do thorough occupational therapy assessment and intervention. I ask my patient about their social background, how they were managing before within their activities of daily living. That includes how they were managing with washing and dressing, with their meal preparation at home, how they managed to go to toilet. And also, I ask them on how they're managing right now within the hospital. And also another responsibility after that assessment, so we do provide various therapeutic modification techniques, and this include fatigue management, energy conservation techniques, pacing techniques, and also relaxation techniques. So this help to manage the side effects of the cancer treatment. And as occupational therapists as well, we do provide equipment. So this equipment is to promote and facilitate independence of the individual, for them to be independent again, be able to get washed and dressed, be able to get on and off toilet or in and out of bed, to manage their independence within the day-to-day. And for patients with really complex needs, like for example, presenting neurological symptoms and presentations, occupational therapists also do some assessments like sitting and postural assessment that is working on for the individual to be able to sit again. It could be cognitive rehabilitation, working in the individual about their thinking process, and also working with the individual in terms of how we can make their upper limb or arms working again, and functional training. So functional training is about returning the individual to be able to manage independently again their activities of daily living. Occupational therapists also do community referral, so specifically rehabilitation referral. So the purpose of that is to help and support and to optimize the function of our cancer patients as much as possible. And with all these assessments and intervention and responsibilities we do, we always aim to improve quality of life of the individual, and also making it sure that we always support and respect patients' wishes and families' wishes. And lastly, main responsibility as well, being an advanced occupational therapist within the hospital, is I partake to the invites and participate with the cancer professional forums within the hospital, and be involved in the therapy planning for the new Cambridge Cancer Research Hospital. I remember this cancer patient that I had in the past. I will never forget him because he was one of those, despite of the cancer diagnosis, despite of the cancer treatment journey, he remained very positive, he remained very optimistic with his view in life, until his functions significantly fluctuated or changed. So sometimes he had a good day where he could do a little bit for himself, and also he had also a bad day when he can't even get out of bed. So that was like a big challenge for that patient of mine and for myself as well as a practitioner. So what I've done is I ensured with my assessment intervention to make sure that I accommodate the good days and the bad days, making it sure educating and providing the individual and the family with all the modification techniques, and ensuring as well that the equipment really essential have already been set up within home environment. So with that, the patient and the family managed to be less anxious, and they managed to regain the confidence about returning home. And they felt very reassured and very thankful about that. And I think that was a very positive outcome. One of the challenges I experience managing my cancer patients is the multifactorial functional impairment and barriers. What that means is, it's a combination of all the difficulties that the cancer patient is experiencing. It could be like physical difficulties, it could be like the cognitive difficulties. They're having like problems with their thinking process, and then also they are experiencing like low mood or feeling down. So I think with those multiple factors, sometimes it could be very overwhelming to the patient and to the family. And similarly, it could be very overwhelming as a practitioner, because I have this passion to ensure to provide best possible of care to the patient and to the family. And with that, I would say it's one of the challenges that I still, until now, I try to overcome, because every single patient is very individual and different. And one of the rewarding things I would say within my career working with cancer patient is when I hear and when the patient and family say thank you to you for all my hard work, for all my support. And most importantly, every time I would hear that they had a good experience during their inpatient stay, for me, that's very rewarding as a practitioner. So occupational therapists collaborate very closely with physiotherapists. So that is to address their physical difficulties. So we do collaborative working with the patient and family as well, making it sure that we can optimize their function as much as possible before they go back to the community. Occupational therapists also collaborate and working closely with the nursing staff on the ward. So that is to make sure that every aspect of the activities of daily living are being covered so that we can recommend the best possible care when they're ready to go home. Occupational therapists also regularly liaise with the complex discharge team within the hospital. So this is ensuring that the recommendation of the suitable care will be in place before the individual goes home. And then also making it sure that the equipment essential for their discharge is in place, and making it sure as well that all the necessary community referral will be done before we send the patient back to their own home. My message to the patient and to the public is, I say thank you for them being involved in the cancer research within the UK, because sharing their experience and their cancer journey really help to shape the research in cancer. And in the profession of occupational therapy as well, we have recognized that within our practice, there are still gaps within the evidence-based practice. One of those is identifying the patient outcomes within cancer research. And also the profession in occupational therapy has been also recognizing the increasing complexity within cancer patients. And this is one of the areas that the occupational therapy profession is trying to address as well.